Hi, I'm Dr. Kavin. Welcome to my channel. As an infectious disease physician, I see patients with a variety of infections. Regardless of the type of infection, however, two questions that patients always ask me are A, how did I catch this infection? And B, what steps can I take to prevent this from happening again? And so in this video, I'm going to try and answer those questions by discussing the 8 ways that germs are spread. After we discuss each mode of transmission, I'm also going to equip you with scientifically proven techniques that you can use to protect yourself against the spread of germs. These techniques can be applied towards the prevention of just about any infectious disease you can think of, whether it be from a bacteria, a virus, a parasite, or a fungus. By shedding light on the science behind germ transmission, I hope that I can help promote a cleaner and safer environment for you wherever you are. So stay tuned. So let's dive right in and talk about the 8 ways that germs are spread. The first way that germs are spread is through droplets. Droplet transmission occurs whenever a sick person talks, coughs, or sneezes. Coughing and sneezing can allow tiny droplets filled with germs to be expelled from that sick person's mouth. If these droplets then land on someone else's eyes, nose, or mouth, then they too can catch the infection. Our eyes, nose, and mouth are especially vulnerable to catching germs because they're lined by a mucous membrane. A mucous membrane, unlike skin, tends to be more permeable to germs. Many respiratory infections, like the common cold and flu, are transmitted predominantly through droplets. Now, there are several ways that you can protect yourself and others against droplet transmission. Number 1, practice proper respiratory etiquette and ask others to do the same. Cover your mouth whenever you cough or sneeze, ideally with a tissue. If you don't have a tissue available, then sneeze into your elbows. It's best to avoid sneezing into your hands because otherwise you can spread germs through hand contact. Number 2, wear a mask. If others around you are sick, donning a mask will prevent their respiratory droplets from reaching you should they cough or sneeze. Conversely, if you're sick, donning a mask will prevent you from spreading your germs to others, like the people you live with. Number 3, socially distance. Maintaining a distance of at least 6 feet with an infected person will allow gravity to pull down those droplets before they make contact with you. And number 4, vaccinate. We have safe and effective vaccines available for many of the common germs spread through droplet transmission, including flu, COVID-19, and RSV. Vaccination can protect you in 2 ways. Number 1, it can reduce your chances of catching the germ. And number 2, if you do still catch the germ, then it can reduce the severity of your illness. The second way that germs are spread is through direct physical contact. Direct physical contact includes actions like touching, kissing, and engaging sexual activity. It also includes bites sustained from humans and animals. Germs can be transmitted through any one of these means. For example, adenovirus, one of the causative agents of pink eye or conjunctivitis, is typically transmitted by contact with an infected person's eye. The Epstein-Barr virus, which is a causative agent of mono or infectious mononucleosis, is typically transmitted through the passage of saliva during kissing. Sexually transmitted infections, or STIs, like HIV, gonorrhea, chlamydia, are typically transmitted within reproductive fluids during sexual activity. To protect yourself against germs acquired through direct physical contact, the best action you can take is to avoid contact with persons who are sick. Encourage them to rest until they feel better. To protect yourself against STIs, use a form of barrier contraception, like a condom. It's important to note, however, that while condoms are effective against many STIs, like HIV, gonorrhea, and chlamydia, they're less effective against others, like herpes and HPV. To protect yourself against infections resulting from an animal bite, you should clean the wound immediately and talk with your doctor about the next steps. Depending on the circumstances surrounding the bite, you may require post-exposure prophylaxis against rabies and tetanus. The third way that germs are spread is through fomites. A fomite is an inanimate object capable of harboring germs. It's typically a high-touch surface like a doorknob, sink faucet, or keyboard. That object then serves as an intermediary in the chain of transmission. For example, if I have the flu, I might transmit the flu to you by coughing on you. This would be an example of a droplet transmission. I might also transmit the flu to you through direct physical contact. For example, if I wipe my nose and then shake your hand, if you then wipe your nose using that same hand, you might also contract the flu. But a third way I might transmit the flu to you is through a fomite. If I wipe my nose and then touch a doorknob, if you then touch that same doorknob and wipe your nose, you might also contract the flu. The best way to protect yourself against fomite transmission is to cultivate good hand hygiene. Regularly wash your hands and avoid touching your face. The fourth way that germs are spread is through the ingestion of contaminated food. Ingesting contaminated food can allow germs to enter your body through the lining of your stomach and intestines. Food can become contaminated during various steps along the food production chain. For instance, maybe the equipment used to grow or process the food is contaminated. Maybe the food is left out too long on the loading dock during distribution. Maybe the food service worker prepping your meal is sick and not practicing proper hand hygiene. To minimize the risks of a foodborne illness, there are several steps you can take. Number 1, thoroughly wash fruits and vegetables. By thoroughly washing your produce, you can eliminate any germs that might be coating the outside. Number 2, avoid the consumption of raw or undercooked meat. Make sure to thoroughly cook your meat products to an internal temperature of at least 140 to 165 degrees. The exact temperature varies based on the type of meat. Number 3, refrain from consuming unpasteurized dairy. Dairy products that are available on the shelves of grocery stores in the US are typically pasteurized, but there are exceptions, particularly abroad. Avoid these. Number 4, do not leave food out. Bacteria grow best within the danger zone, which is between 40 and 140 degrees Fahrenheit. For this reason, leaving food out even for a couple of hours at room temperature may predispose to the growth of bacteria. Refrigeration, on the other hand, maintains the temperatures to below 40 degrees Fahrenheit, inhibiting bacterial growth. The fifth way that germs are spread is through the ingestion of contaminated water. In the US, while there are exceptions, the risk of acquiring a waterborne illness from tap water is relatively low. This is mainly because of the widespread treatment of tap water with chlorine to kill germs. Even though the risk of acquiring a waterborne illness from tap water is low, since it's treated, you can still acquire an infection if you consume untreated water. A common scenario I see this playing out in is during recreational activities involving natural water sources, like swimming, for example, in a lake, a river, a pond, or a stream, or even the sea. It can also occur during hiking or camping if you consume water from a natural source without first treating it. Additionally, even though we in the US are fortunate enough to have clean tap water and modern plumbing, many foreign countries are not. And so it is still possible to pick up a waterborne illness from tap water during travel abroad. The best way that you can safeguard yourself against waterborne illnesses is to avoid the consumption of untreated or contaminated water. If you're traveling overseas to an at-risk area with poor sanitation, consider boiling your water first before drinking it, as boiling the water will kill any germs. Additionally, if you're engaging in any recreational activities involving natural water sources, try to keep your mouth closed and avoid ingesting any of the water. The sixth way that germs are transmitted are through vectors. Vectors are tiny blood-sucking bugs like ticks, mosquitoes, or fleas, which can transmit germs during feeding. Different vector-borne diseases predominate in different parts of the world. For example, in the US, the most common vector-borne disease is Lyme disease, which is transmitted by ticks. On the other hand, the most common vector-borne disease in most resource-limited countries is malaria, which is transmitted by mosquitoes. There are several ways that you can protect yourself against vector-borne diseases if you anticipate exposure. For example, maybe you're about to go hiking, or maybe you're about to travel to a malaria-endemic country. Number 1, wear long-sleeve clothing. By wearing long-sleeve clothing, you minimize the surface area of exposed skin, making it harder for bugs to bite you. Number 2, apply an insect repellent containing DEET. DEET works by making it difficult for bugs to smell people. Number 3, treat your clothing with permethrin. Permethrin works by acting as a potent neurotoxin for bugs. Number 4, perform a daily tick search. Before sleeping, perform a head-to-toe inspection of your body to assess for any ticks that may have latched on. If you spot a tick, you remove it by using tweezers and grasping the tick as close to the skin as possible. Number 5, sleep with a bed net. Bed nets are mesh curtains which create a mechanical barrier around a sleeping person. This protects the cocoon person from mosquito bites. And number 6, use prophylaxis. Before traveling to a malaria endemic area, make sure you see your doctor for a pre-travel consultation. Based on the nature of your travel, you may benefit from medicines for prophylaxis. The seventh way germs are transmitted is through the air. Airborne transmission refers to the spread of infectious particles through air currents. Whenever you cough, you release large droplets into the air. Most of these droplets are large enough for gravity to act on them to pull them down. Some of the droplets, however, will evaporate and give way to dried residue known as droplet nuclei. These droplet nuclei are so small that they're able to resist the downward pull of gravity and instead use air currents to disperse. This is known as airborne transmission. What separates airborne transmission from droplet transmission is the ability of airborne transmission to occur over long distances and across time. While some airborne germs originate from people, like those causing tuberculosis, some can originate directly from the environment. For example, many household molds release spores into the air. If you then inhale those spores, then you can develop a mold infection in the body, particularly if you have a weak immune system. Some ways you can protect yourself from airborne transmission include: number 1, avoid crowded public areas, especially if poorly ventilated. Poor ventilation can predispose to a buildup of airborne germs. Number 2, avoid anyone who has an intense or persistent cough. If that person has an airborne infection and you breathe the same air as them, then they can pass on that germ to you. Number 3, keep human areas like the bathroom properly ventilated. This can help prevent the buildup of mold, which loves humid environments. And if you do have a mold problem in your house, then take steps to address it immediately. The 8th way that germs are transmitted is from mother to child. This is known as vertical transmission. There are several ways that a germ can be transmitted vertically. It can occur during pregnancy, where germs can cross the placenta from the mother into the developing embryo or fetus. It can occur during labor and delivery, when the newborn is exposed to the mother's blood or bodily fluids in the birth canal, and it can also occur during breastfeeding, where certain germs can be transmitted through the breast milk. The best way to prevent against vertical transmission is to seek prenatal care if you become pregnant. As part of your routine prenatal evaluation, your OB/GYN will perform several tests to assess for different germs. If they find that you're positive for a specific infection, they can prescribe you certain medications like antibiotics or antivirals to reduce the risk that you'll pass on that infection to your baby. So there you have it, the 8 ways that germs are spread. I hope you found this information useful. If you did, then go ahead and give this video a like. For more helpful content like this, don't forget to hit that subscribe button as well. And if there are any specific infectious disease topics that you'd like me to cover in future videos, then feel free to let me know in the comment section below. Thanks for tuning in.